The Communities Care program started in 2012, and it was designed to address gender-based violence, targeting different types of violence, intimate partner violence, sexual violence, FGM. And it was designed with a twofold objective. On one side, to strengthen the response system by training the service providers, and on the other hand, to work at community level through a toolkit developed together with UNICEF to change harmful social norms, to fight against these harmful social norms that are the root causes of the gender-based violence, and replace them with positive social norms that fosters gender equality at community level. My function in the program was the overall supervision of the program. Due to the context of Somalia, where there is a lot of conflict, and especially the presence of Al-Shabaab organization can make difficult for communities together around a place where they can discuss. So in those cases, the program was less effective, where there was no challenges in terms of public gatherings. Challenges are, first of all, at the beginning was community acceptance. But as I said before, whenever we managed to involve community leaders, and that acceptance has been growing along the process. Another challenge is the legal framework in Somalia, because it's very confusing, because there are substantially there are two different frameworks. One is the government constitution and government laws, and on the other hand there is the Sharia laws. And the two systems are not always consistent. For instance, to make an example, on the age for marriage, which is not consistent between the two systems, so there is a lot of confusion. And for instance, another example is there is no law against FGM in Somalia, so technically it is permitted by the law, this practice. And the sexual act that was under discussion has never been approved. So the legal framework is not very favorable to conduct this kind of interventions. So after the pilot phase, as I said, it was implemented in Mogadishu, Banadi region in Somalia. Then we entered the second phase of the scale-up, where we changed CSP, our role. We turned to be capacity builders of a local and grassroots organization that allowed us to scale up the project in all the other states of the Federal Republic of Somalia, and targeting many other locations. And this has been ongoing for additional 4 years. And we're working with several partners that we trained, we built the capacity, and with a constant mentorship and coaching during the implementation of the activity and the collection of data for the assessment. The adaptation, which is now ongoing under the World Works program, is the reason why we decided to do that is because even the context of Somalia and the rooted causes on gender issues, we thought that it would be good to start this conversation at community level at an earlier age, so targeting also adolescents and children. So basically we are trying to adopt the model to a context, to the school context, to start early, to try to work on these social norms, harmful social norms, shift towards positive social norms. The challenges in this case was related exactly to the context of the school, specifically because we had to engage the Ministry of Education, which posed a number of challenges in the curriculum that we wanted to propose to the school, basically, given that there are many sensitive topics that they didn't think that they were appropriate for a school environment to discuss with children. So there has been a a long back and forth discussion with them. But finally, we managed to have the toolkit and the guide that we are using approved and endorsed by the ministry. So the challenge has been overcome. As an advice, given the challenges, to make sure to involve the stakeholders since the beginning, specifically religious leaders on one hand and government officials and line ministries on the other hand. That would facilitate the process and facilitate the acceptance both in terms of institutions and communities.